Hello friends. How are you all? Hope you all are fine. Today shall we discuss 15-mark question from 2013 August question paper?
Sure. Then I will read the question. The question is define cardiac cycle. Describe in detail the changes that occur in different phases of cardiac cycle.
Cardiac cycle is the sequence of events that occur when the heart beats. One cardiac cycle is defined as the contraction of the two atria followed by the contraction of the two ventricles. This is pumping of blood from the heart when the heart is filled with the blood.
What are the events of cardiac cycle?
The events of cardiac cycle are divided into two. They are atrial events and ventricular events. The atrial events are atrial systole and atrial diastole. The ventricular events are ventricular systole and ventricular diastole.
What is the duration of cardiac cycle?
When the heart beats at normal rate of 72 beats per minute, the duration of each cardiac cycle is about 0.8 seconds.
What are the subdivisions of cardiac cycle?
The ventricular systole consists of isometric contraction and ejection period. Ventricular diastole consists of protodiastole, isometric relaxation period, rapid filling phase, slow filling phase and last rapid filling phase.
What is atrial systole?
Atrial systole is also known as last rapid filling phase or presystole. It is considered as the last phase of ventricular diastole. Duration is 0.11 second. During this period only a few amount of blood is forced from atria into ventricle.
What is atrial diastole?
Atrial diastole starts after atrial systole. Simultaneously ventricular systole also starts. Atrial diastole lasts for almost 0.7 second. The long atrial diastole is important because this is the period during which atrial filling take place. Describe isometric contraction period.
It is the first phase of ventricular systole. It lasts for 0.5 second. This is a type of muscular contraction characterized by increases in tension without any changes in the length of the muscle fibers. Semilunar valves are already closed. Immediately after atrioventricular valves are closed due to increase in ventricular pressure. Now ventricles contract as closed cavities. Only the tension increase in ventricular musculature. What is ejection period?
Due to the opening of semilunar valves and isotonic contraction of the ventricles, blood is ejected out of both of the ventricles. Hence this period is called as ejection period. The duration of ejection period is 0.22 seconds.
What are the stages of ejection period?
Ejection period consists of two stages. Rapid ejection period and slow ejection period. Rapid ejection stage is the first stage, starts immediately after the opening of semilunar valves. During this stage, a large amount of blood is ejected from both ventricles. It lasts for 0.13 seconds. During slow ejection stage, the blood is ejected slowly with much less force.
Give some details about protodiastole.
It is the first stage of ventricular diastole. Its duration is 0.04 seconds. Due to the ejection of blood, the pressure in aorta and pulmonary artery increase and pressure in ventricles drop. What is isometric relaxation period?
It is a type of muscular relaxation characterized by decrease in tension without any change in the length of the muscle fibers. During this period, once again all the valves of the heart are closed. Intraventricular pressure decreases. Duration is about 0.08 seconds.
What is rapid filling phase?
When atrioventricular valves are opened, a sudden rush of blood from atria into ventricles happen. So this stage is called the first rapid filling phase. Ventricles also relax isotonically. About 70% of filling take place during this phase, which lasts for 0.11 seconds. What is slow filling, please?
After the sudden rush of blood, the ventricular filling becomes slow. About 20% of filling occurs in this phase. Duration is 0.19 seconds. What is last rapid filling phase?
Last rapid filling phase occurs due to atrial systole. After slow filling phase, the atria contract and push a small amount of blood into ventricle. Flow of additional amount of blood into the ventricle due to atrial systole is called atrial kick.
Hey guys. We have completed one 15-mark question within few minutes. Let's meet tomorrow with another question. Bye.
Bye.